What's the current status of Geisinger Medical Center?
Well, we're doing just fine. Yes, we are busy, as we usually are, right?
Right.
Um, but with COVID going around, we are definitely on heightened alert, shall we say.
Are you beginning, I know you can't talk about patients specifically, but what symptoms are you beginning to see make their way into your ER?
Sure. So, most patients who have this infection have fever and cough. Those are probably the two most common symptoms. Some people will go on to experience some shortness of breath, right, and feel like they're having trouble with their breathing. Those are the people that usually do, of course, wind up in our emergency room or in our doctor's offices seeking some care. Whereas others might be staying at home just because they feel a little lousy, but otherwise are okay. And of course, we do have some of the extreme cases, right, where people really are struggling to breathe so much that they need help and support with that.
So how do these symptoms for COVID-19 compare to, say, a flu or even allergies or even past coronaviruses like SARS or MERS?
Yeah, it can be very similar to the flu. I'm not sure you can always distinguish it from the flu just by itself, because the flu also often presents with fever, cough, right? Lots of malaise or myalgias, as we doctors like to say, with the generalized body aches, right? That's fairly common with this as well, and fairly common with the original SARS outbreak back in 2003. Now, with the original SARS outbreak back in 2003, we had a higher percentage of people who experienced the breathing problems. And you can sometimes, of course, see that with influenza as well.
So are you surprised? I know personally I'm a little terrified of the randomness of what cases become serious and what cases don't. I mean,
Well, it's not entirely random, but you're right. Sometimes we do see folks who are pretty sick who don't have any obvious risk factors for that. We do know that people who are older, and I'm going to define older here as greater than 60, okay? People older who have certain kinds of medical problems, right? Things like lung problems, COPD, emphysema, people with heart problems, heart disease, even diabetes to a certain degree, seem to be at a higher risk for having some of these more serious complications.
and we're still baffled by the fact that children have been relatively spared.
Yeah, so they seem to certainly have a much milder illness. They can get the infection just as easily as an adult. Some might say even easier because kids don't tend to be quite so careful when it comes to germs, right? But yes, they don't seem to have as severe an illness. They can have symptoms, and some of them do get sick, but not to the degree that we see with adults. They can unfortunately serve as vectors in the community, though, and right, spread it to vulnerable adults very easily.
Well, let's dovetail on that real quickly. The whole mask issue, because that's one way of spreading it. It seems like, washing our hands was the big thing at first. Now, is it droplets in the air that could be the big factor? And does that mean wearing masks?
Yeah, this is a question we get asked all the time, not just outside of our hospitals, but of course, even inside the hospitals. What role are masks serving to help prevent infection? And in some settings, they clearly are serving a role, particularly for doctors or other healthcare workers who are working very closely with patients. Masks can be very important to try to prevent infection. Outside the hospital setting, the role for masks is much less clear. There's two scenarios where it might be of value, right? So certainly if you yourself are sick and have the virus, if you wear a mask out in public, you are much less likely to spread the virus, right? So there's one possibility. The other possibility, of course, is being around asymptomatic individuals who might potentially spread the virus. We know that that can happen, although we're not sure to what degree, And it probably is a relatively small percentage, but nonetheless, is there a role there? The problem, of course, in the community is that wearing a mask for most scenarios probably doesn't help. And most of the masks aren't necessarily at the medical grade quality you want in order to prevent the inhalation of droplets. Also, when people wear masks, they tend to wear them for a really long period of time, and they can get dirty and they can get contaminated. And people who wear masks a lot tend to touch their face a lot. And we know that that's a problem because, for sure, spread of the virus in the community happens a lot with the touching of the environment, right? So the people with the infection, they're coughing, they're talking, respiratory droplets are coming out, landing on surfaces around them, you know, and now you walk into the room, you're touching the table, and now you're touching your face, and voila, you have the infection. And that's why hand hygiene is still critically important, and the most important thing, I would say, for everybody in the hospital or in the community to try to help prevent the spread of the infection.
Social distancing too is still too big, right?
Social distancing definitely can help, right? Because then you're preventing that contact, that direct contact. You're helping to prevent some of that contact with the environment as well.
Now, not up on the latest numbers for today, but it seems up until this point, at least to the general public like myself, that our area has been relatively spared. When do you foresee that changing? I'm hearing mid to late April.
That's probably right. There's a lot of models that try to look at this, right? You know, a lot of calculations that we try to make to help determine that. We see that it is essentially kind of marching from the east across the state, although we have cases in central PA, we have certainly cases in western PA, right? But for the most part, we see the surge kind of making its way from the east. And so most of the things that we're looking at would say it's going to be in the 2 to 3 week range from where we are now.
Now, if you're like me and you're out there playing the waiting game, how will this surge or the continued march to the east present itself to the general public? Are we going to start seeing our friends and neighbors getting sick?
Well, if everybody's practicing social distancing right and not going outside unnecessarily and sticking with strict hand hygiene measures, we're not going to see that to the same degree. And that's why this stuff is so important. Because even though we're going to see some infection and we're going to see it spread across the state, if it can be slowed down, we can delay that peak, we can decrease the severity of the peak in such a way that all of us will be much safer to do so.
So when this does happen, when it does begin to present in 2 to 3 weeks, I imagine Geisinger has a plan that it will go into place if it hasn't already.
Yeah, we've been talking about this virus since the middle of January, right? And have been preparing for it since that time through a number of different measures. All of our hospitals, not just here at Geisinger Medical Center in Danville, but all of our hospitals have plans in place and have expanded our ability to try to increase the capacity to handle a lot of sick patients. We have turned entire wards in the hospital over to a setting where we can potentially take care of a lot of patients with this disease. Lots of stuff goes into trying to prepare, and I think we've been doing just that, yes.
Our lessons learned by watching what's been going on in Italy, Spain, what they did in China, South Korea, Singapore, and now even New York City.
Yeah, some of these countries have fared better than others when it comes to this infection. In part, that has to do with some bad luck as to who the population is that's been hit the hardest. In part, it has to do with the preparedness of the medical system, and in part, how easy it is to test and to screen patients and to use isolation measures, et cetera. In the United States, I think we've become the world leader in this infection probably at this point in terms of the number of cases, right? And we have a lot of heterogeneity throughout the country when it comes to healthcare and how we manage these kinds of issues. But none of us are going to be spared, right? We're all going to have to deal with this in one way, shape, or form.
Do you think the hospital, and now taking into account everything that's happened in Italy, Spain, New York City, especially New York City, what we're seeing now with personnel, what they're dealing with, and even supply issues, are you ready for that?
We're as ready as we can be. I mean, the supply issue is one which has plagued the entire country, right? Do we have enough ventilators? Do we have enough masks? Do we have enough of certain medications to be able to manage patients? And like I said, we've been working on this since January to try to make sure our access to this material is as good as it can be. But at the end of the day, there still is a finite number for all of us. What can I say? We're all working hard to try to overcome that.
What more are you learning about the virus now as time has progressed from when it first became public in China to today? Is there anything that you have learned about the way it strikes? And I understand sometimes different symptoms come into play that weren't necessarily from the initial, like diarrhea.
Yeah, although some of those are still pretty uncommon. We are learning some things about the biology of the virus and its kind of natural history. We're learning some things about what medications might help treat it. There's no proven antibiotic per se, like you can use for a bacterial infection, but there are some medications which may seem to slow down the virus a little bit. And there's all sorts of studies being done with different, even new therapies to see what kind of role they can have for treating this virus. And Geisinger is participating in some of those studies as well.
Is testing still a big issue? I mean, are we doing enough tests to catch this?
We are certainly doing a lot of tests, I can tell you that. We have opened up these testing centers at various locations throughout central Pennsylvania and the Northeast to try to catch people who can be tested. In the hospital, of course, we're testing just about everybody who has symptoms that could be related to COVID, right? Even if we're not entirely sure, we're still testing people because, of course, in the hospital setting, we have to be very, very careful about that.
And testing is still a relatively slow process. You do the test, then you have to wait at least a week, I believe.
Well, so at Geisinger, of course, we can do the test in our own lab, and we're one of the few places in Pennsylvania, actually, that can do that. Only 2 or 3 places can. And when we do that internally, we do get a very quick turnaround on the results. But we still have limited capacity in how many tests that can be done in any given day, right? We continue to expand at a marvelous rate, and our laboratory folks are just been outstanding in the work that they have done. But in the outpatient arena, folks who aren't as sick, when we're sending the test out to another laboratory to be done, yes, it can take some time. It can take days, and sometimes, yes, as much as a week or so to get results back. And so we tell patients, we think you could have this. We don't have the result yet, but let's just all pretend like, yes, you have it, right? And we recommend the social distancing, the home isolation, the hand hygiene, the measures to try to prevent spread of it to others in the meantime.
So you're able to screen patients right there at the medical center. You can tell who probably has it and who doesn't. And therefore, the ones who don't, maybe the test isn't as quick a result as the ones who might be a positive?
Well, we try to be discriminate about who should be tested, right? And if we think that they could have the infection and their risk for complications of the infection, right? If you're a healthy 20-year-old and you have symptoms that are compatible with COVID, but you're fine and you don't need to be in the hospital, you know, why should we do a test? Why should anybody do a test when we have limited numbers? We're just going to tell you, hey, you probably have this, you know, do some of these measures we talked about so you don't spread it to others. And, you know, we'll check on things. If you get worse, then obviously we want to reevaluate.
What's your sense on the future? You said 2 to 3 weeks it should be hitting it hard here. Beyond that, how will it sweep through? How long will that process take for it to move through this area?
Yeah, you know, when we talk about a peak, it sounds like once you just peak, then you're done, right? It just drops back down, and that's clearly not going to be the case. It's going to peak. It may even plateau for a period of time, right? And then the drop down, the decline is probably going to be a slow process. It's certainly not going to happen overnight. I suspect we're going to be dealing with this for the coming months.
And I've already heard today, or I've seen today, that even parts of Asia are starting to see a second wave. Is that a possibility as well for us?
It's certainly possible, right? It depends on how good we are at controlling the spread of the virus. It might depend a little bit on how the virus itself changes. There's still a lot that we don't know about the immunity to the virus and what that's going to look like for people in the long run.
Do we know yet what the rate of infection is? I mean, there are some people who won't even be asymptomatic to this, who just will not even get it. Is that possible?
Certainly possible. I certainly hope that that's the case, that a lot of people don't get it. And if we practice these measures, we know we can prevent infection, right? But as far as natural resistance, which is maybe what you're asking me
Yes.
about, I'm not sure we know the answer to that just yet.
All right, so on a personal note, when you first began your medical career and decided to head down the road of being in infectious disease, did you ever foresee yourself dealing with something like this?
Well, when I first started out, interestingly enough, it was during the original SARS outbreak, right? And so I think we were mindful of the fact that infectious diseases were a global issue, and it wasn't something that was just localized to one place. But I think knowing that theoretically is one thing. You know, seeing it with your own eyes is another thing, right? I remember when we had the Ebola scare a couple years ago in the United States, right? Even a few years prior to that, if you'd come to us here at Geisinger and you said, hey, you know, you should probably have a protocol for how to deal with an Ebola patient. You know, we would have said, what, are you kidding? That seems ridiculous. But of course, we do have a protocol now for how to deal with Ebola, and every hospital does because of what we've seen change over the years, right? And so I don't know, maybe in some ways we shouldn't be surprised that a pandemic like this is happening. And this probably is not going to be the last.
How are you dealing with this personally?
Well, I think one of my colleagues said it best when he described it as acute on chronic anxiety. You know, there are moments where you're more anxious than others, but even when you're less anxious, you're not completely devoid of it. And it's stressful for everybody. It's stressful for, you know, families. It's stressful for patients. It's stressful for children, you know, even though they may be fine health-wise, to not be at school, to not be around their friends, right? It's stressful for everybody. But these are the cards we're dealt, and we know how to deal with it. It's just a matter of doing it.
Perfect way to end this. Thank you very much, Dr. Martin, for your time.
You're very welcome. Take care.
It's been a pleasure. Be well and take care, and thank you so much for what you're doing. We're all pulling for you.
I appreciate that. Thank you.